Welcome to this presentation on the ongoing struggle for water in Metche camp in Chad. This is for the European Environmental Health Forum. It is presented by me, Paul Jawor, the technical referent for WATSAN in Barcelona, Olivier Kamto, who is the mobile support technician WATSAN, and he's actually there in Chad, so we apologize for any connection problems. And we're doing it from Médecins Sans Frontières, Doctors Without Borders, the Spanish section. So let's have a little look at the content we're going to go through today. I'll do a very quick, brief context so you understand what's going on, and then we assess the needs. From then we devise some actions. We came up with a solution to test, and hopefully we can share with you some conclusions that could be useful to you at the end. So for the context, as you might know, there is a war in Sudan, and a lot of the population are forced to run across the border into Chad. In Chad, they are put in camps along the edge of the border, and one of these camps is Metche camp. It has a population, when they were there in September, of around 40,000 people. And Chad is famous for its water scarcity anyway, and with an extra influx of 40,000 people, we discovered there was a very big emergency situation because there was just not enough water. This is just an idea of the scale of the map that you have for Metche base camp. You can see in it the location for the zones and the areas and the tent set up in the area. At that time, there was very little water supply in the camp, and you can see by the layout, it was quite a spread out camp. So the needs. MSF, as you might know, Doctors Without Borders, is a medical organization, and we focus on medical care. In our analysis of what is needed in Metche, we thought we'd have to, or we tried to build a hospital, and we construct a hospital for the population of the camp and the surrounding host people. And we thought that this is what we should do in Metche. And of course, we want to ensure that we have a good quality of care in the hospital. But in order to do that, we need to have water.
So in our quest for finding water in Metche, we contracted groundwater relief to assist us to a geophysics survey. We used the 2D electrical resistivity tomography method. Why did we go to UK was because we tried sourcing in Chad and we were not able to find reliable partners with whom we could work. From our study with groundwater relief, we were able to identify 15 probable drilling locations and eventually tried a few of them, definitely with problems encountered with the drillers. Our idea at the time was to look for a sustainable and consistent water supply source for the people living in the camp. Looking at the results of the geophysics survey, it was assumed that the potential depth for groundwater could be found in saturated sands, alluvial deposits, and weathered granites based on the resistivity values recorded. From the profiles you see on the right, the depths of these layers could be assumed from 0 to 50, 60 meters below ground. Points P, A, and N that you see mentioned are the places where we actually tried drilling. And looking now at the results of our drilling, we came to a conclusion that from the geophysics survey, we actually noticed saturated sands or alluvial deposits in soil layers 0 to 16 meters below ground, or granite 12 to 60 meters below ground. And also interestingly, in these layers, we noticed the presence of water in different soil formations across the 3 different boreholes we drilled. Doing the deep boreholes came with several challenges. First, being administrative, because it was a little bit difficult to find reliable contractors, and those we found were most at times trying to subcontract and making management a little bit difficult. Operational issues also, because we were located 18 kilometers away from Metche at the time, and because of our internal regulations, movements were restricted and our teams could not physically be present at all times when the drillers were doing the work. Equally, there's logistics supply, sourcing for good quality material, the pumps, the pipes, the power supply, etc. Because in Metche, we are almost 1,500 to 1,600 kilometers away from N'Djamena, which is the main supply hub in Chad. You can say, therefore, that doing the boreholes is a very good long-term solution, but require adequate design and planning, which sometimes could be time-consuming.
So as you saw from Olivier, we were having trouble with the boreholes. The boreholes were being delayed, and these consequences meant that there was still little or no water supply. And the emergency was, we need water in Metche camp now. So what to do? So the solution, talking to the Chadian and Sudanese, they have knowledge of how to identify where water could possibly be from their experiences. And together with simple divining techniques and maybe a lot of luck, we started to identify where it was possible to dig shallow hand-dug wells or shallow boreholes, hand-dug boreholes. However, we knew that the possible locations of shallow boreholes and the capacity of the shallow boreholes seen are not too sustainable, because we're not too sure how the water will drop. But we need water now, so we went ahead. So to do it, we had to adopt and adapt to innovate a new solution. So combining their procedures from the Chadians and the Sudanese ideas with the MSF jetting procedure, we adapted to use a larger diameter pipe in the ground, and we cut hand screens in it so it would take the water in. Using a jetting technique of forcing water down the center of the pipe, we created a kind of slurry in the pipe, which enabled us to actually push the pipe physically without a drilling machine to up to depths of 9 meters, which is quite good, because if you heard earlier, there was a possibility of water in the sandy layer from 0 to 16 meters. And this was what we were tapping into. And luckily enough, we were quite successful. So as you can see from the map again of the camp with the different zones and the tents, you can see the red circles. And the red circles were where we managed to find water by doing these shallow boreholes up to 9 meters deep, shallow hand-dug boreholes. And you can see they're situated along the wadi and by the side of the wadi, and in areas where was advised by the community and advised by the GWR that it was possible to find water supply.
So following these, our hand-dug boreholes and wells, which we did, you can see from the graphs here the evolution of water supply we were able to supply in the camp. We reached a peak of over 600 meters cube of water per week, and this improved the amount of water which was being supplied to the camp prior to our arrival, which was estimated at about 3 liters per person per day. And by the end of March, we were assuming the supply of water in the camp to about 15, 16 liters per person per day. And while extracting all of this water, as you remember, we initially thought that the hand-dug boreholes could be a non-sustainable solution. So we were trying to monitor the static water levels in the hand-dug boreholes to observe if there was any drop. Between November and February, we noticed a fairly stable static water level in the boreholes, but between February and March, there was an average 90 centimeters drop recorded.
So from that, we can try and share with you some conclusions. So with the knowledge guided by the Chadians and the Sudanese and their solutions they thought of, and combining it with our location devices, we were able to meet the initial needs for the population through our shallow dug boreholes. But we need to be able to assess if there's any damage to the superficial aquifer, because all these boreholes are shallow, with all this water being taken out. And how does that affect it? So here are some of our thoughts.
Yeah, we were wondering what could be the actual storage capacity of the saturated sands of the alluvial deposits below ground. Equally, how interconnected are they? Do they have a longitudinal profile? But also we're wondering what could be the optimal exploitation of the hand-up boreholes we did, and also if properly built, properly protected, could they be a reliable solution and perhaps be a solution to replace the deep boreholes for long-term water exploitation? These were a couple or several of the questions we were asking ourselves and which we were not able to answer. And perhaps we invite you to also think this out with us.
So in the summary of what we've done today, we want to say that despite the challenges that we faced, we can say that with the combination of people's knowledge and the modern science and adaptation that we used, MSF could respond to the emergency situation and plan for a more sustainable situation for the water scarcity in Metche camp. So thank you very much for listening today, and I think it was interesting. I've left an email address at the bottom if you wish to contact us. So thank you very much from me, and it was very interesting talking to you. And Olivier?
Thank you very much for your attention, and we hope it was interesting and you liked it.
Thank you very much, and goodbye.